You know, something that people don't really think about unless you're in that situation is caring for a loved one who is either aging or has some complex medical issue. And a lot of families here in Charlotte and across the country are dealing with that. Today, we are joined by Yolanda Rhodes. She is a rehabilitation nurse, and she has expertise in caring for patients, especially with spinal cord injuries, traumatic brain injuries. And so we are so happy, Yolanda, that you are here to kind of talk about this, what families don't really know. So let's talk, Yolanda. There are so many things that go into caregiving, right? That everyday Americans don't
Correct.
think about, but it could happen to any of us. So what should people know, especially caregivers and people going into these situations?
Well, first of all, it's more than just medication management, more than just meal prep, more than making physician appointments. One of the biggest challenges that most caregivers are surprised by is the fact that they have to meet those personal hygiene needs. Bathing, dressing, grooming, toileting, and other activities of daily living that have to be performed for their loved one in the home. So that's a big challenge and a big surprise to many people. There's about 63 million Americans that care for an adult or a child that has some type of complex medical condition or disability. And 1 in 4 of those provide over 40 hours of care per week.
And I mean, that in itself is probably so exhausting for these families. It really happens to overnight, right? You have to caregive as well. So what are some things that, first-time caregivers can learn about overnight caregiving and to reduce those interruptions?
As a caregiver myself of my 91-year-old father, I can attest to the fact that overnight caregiving is very overwhelming and it's very exhausting. You want to look at the fact that there's about 25 million Americans with urinary incontinence, and fortunately, there are some solutions. One being the BD Pure Collection System. Some caregivers and loved ones may be familiar with the product from the hospital, but it's also available for home use. And we want to make sure that, that's something, an option for, their loved one to use. It's actually a non-invasive urinary management system that wicks urine away from the body into a canister. And both males and females can use the product. There's also options or solutions such as have like room-to-room monitors so that, the caregiver can hear if their loved one calls out. There's also, clearing pathways to the bathroom and, lighting. We want to have some type of motion lighting or sensors so that if they're trying to navigate to the bathroom, they can make it safely. So overnight caregiving can be very, very overwhelming. Sleep deprivation is real. So that's something you have to think about when you're caring for someone 24 hours a day.
And what would be your best advice to give people who are just newly in this situation? I know that there are a lot of hurdles to overcome, especially making sure that, the people that they're caring for still doesn't feel like they're not a human anymore or that they're always being babysat. What would your suggestions be?
As far as, those conversations with those that feel that, you're basically babysitting them, it's not that you're providing the care that they need. Having delicate conversations with your loved ones about providing their care, and approach those conversations with empathy and respect, first of all. You want them to feel that they're still in control and have some decision making about their care and how you can best help and support them. So making those conversations and time for those conversations are really, really important.
And where would be the best place for people to go to learn more information on caregiving if they're just starting out?
They can use their favorite AI tool to research locations where they may have information on caregiving and resources available. In regards to urinary management, they can actually go to purewick@home.com to learn more about the PureWick collection system as well.
Yolanda, thank you so much for being here. I know you probably really helped a lot of our audience for if they are first-time caregivers or if they've been caregiving for a while. So we really appreciate you being here.
Thank you for having me.